Okay, so now we come to our next topic, that is among the study of indicators. Now we will study mortality indicators. Out of all the indicators which are most important from NEET, NEXT and USMLE point of view are the mortality indicators, giving lot of scope to make questions to calculate various mortality rates. Mortality indicators have been described in 3 chapters in our textbook. One is this chapter number 2 which we are discussing. One is chapter on epidemiology. Again it discusses the mortality indicators and some of the definitions and concepts have been repeated. And then in MCH, that is maternal and child health, there are various type of indicators which become very important there, like infant mortality, stillbirth rate, maternal mortality, child mortality, neonatal mortality. So these mortality will come again there. Here we will study only 4 indicators at this stage, and then we will slowly add later. The first mortality indicator, mortality means death. So death has to take place in our mortality indicators. One thing we can study now, what are the advantages and disadvantages of mortality indicators. Advantages and disadvantages of mortality indicators has been discussed in chapter on epidemiology. But we will combine that knowledge here and finish off the mortality indicators here and now only. The biggest advantage of mortality indicators are that they are very easy to calculate or easy to compute or collect, because death is a very important event in any individual's or community life. I may get a disease, but I may not report to a doctor, or the disease may not be diagnosed. So there are problems with morbidity indicators. I may suffering from dengue, but it may not be diagnosed as dengue. So what will happen, that it will not be recorded as dengue. So morbidity has problems. It requires a better, higher levels of healthcare services. But mortality is very often recorded, and it is very often reasonably diagnosed, correctly diagnosed. Means the broad group will be correctly diagnosed. Even if on my death a priest is there, but priest will be able to say that this person might have died because of heart attack or old age. So he will be able to make some diagnosis, broad diagnosis based on his experience. He may not have a medical knowledge, but he does have experience. So in any developing country or in a remote area like tribal area, mortality indicators are easiest to compute and collect. So that is one of the biggest advantage of mortality indicators. The disadvantages are many. I think Park has given 5-6. So there may not be correct diagnosis. The diagnosis itself may be incorrect. People may say, I have died of old age, but I might have died of cancer lung. The second thing is, all deaths may not be recorded. Now the things have much improved, but people sometimes, they may not record a old person death to the record, or a infant dying or a child dying at birth may not be recorded as a death. So this is one issue. The diagnosis may not be correct. There may be a change in diagnosis. This means, let us say earlier we were dying of lung cancer, but we were not diagnosed as lung cancer because the facilities were not there. But now we have got CT scans and MRIs. So now the diagnosis of lung cancer may increase. There are various other reasons of increase in lung cancer incidence and prevalence. But because the diagnostic facilities had improved. Another disadvantage of mortality indicators is that normally we write only one diagnosis, one cause of death. Let us say we write cardiac or myocardial infarction. But I may be suffering from diabetes also, which has contributed significantly to death. But that is normally not recorded. Even in today's India, the death certificates are not correctly being filled. Lastly, we cannot study diseases which do not kill. How do I study gout from mortality indicator? As a mortality indicators from death certificates or cause of death. So diseases which do not cause death cannot be studied from mortality data. For that we have to go to morbidity data. 4 indicators we will discuss at this stage. First is crude death rate. One may say it crude mortality rate also. Total number of deaths in a geographical area in a given population. Normally we take 1 year divided by mid-year population into a multiplication factor which normally is 1000. So remember, crude death rate is total number of death from all causes is the numerator. Now we will come to, there is one problem with crude death rate, which I teach us why we call it crude. What is crudeness in crude death rate? The crudeness is that age and sex composition of the population affects crude death rate. This means there is a problem of comparison of death rate between 2 places or 2 times. I can explain it better. Let us take an example. Let us learn it. The time should not be a constraint for learning. Let us say in a village and there is a slum area. We find the death rate in village rural population is much higher than the slum area. So we may conclude that rural area is worst for health or slum area is better for health as compared to rural areas. But it may happen that elderly people and old people have stayed back in villages while the younger population have moved to urban areas and they are started living in urban slums because of urbanization, rapid urbanization or unplanned urbanization. So the death rate difference in rural area, higher death rate in villages or village area, rural areas is not more because the environment or problems are more. It is because the population is elderly there. So this type of problems come, which is what is normally a phrase used in, it has been asked in NEET also. Crude death rate has a problem, it cannot be compared and it is crude because of age and sex composition of the population. At this stage we will just remember or learn that this crudeness can be made uncrude by a process or mathematical problem, process called standardization, which is of 2 types, direct and indirect, which we will do sometimes later if you want to. Slightly difficult, but has been asked in NEET. So we should do it for NEET and next. The next indicator is specific mortality rate. Now specific mortality rate is, the numerator is death rate from that specificity. That specificity may be disease specific, it may be gender specific, it may be age specific, it may be area specific, it may be religion specific, it may be occupation specific. So what will be the numerator? Let us say TB specific. So TB specific mortality rate will contain as the numerator all cases of death because of tuberculosis in a year into a multiplication factor which is over 1000 divided by mid-year population. Gender specific, let us say women specific mortality rate will be number of deaths among women in a year into 1000 divided by mid-year population of women. Now this concept has been very nicely explained, and it becomes a very, very important concept in community health, community medicine, public health. That is called, the denominator should be population at risk. Normally we say that denominator should be such, it consists of such people who can come in the numerator. Next is proportional death rate. Now proportional death rate is death rate because of a specific factor. Let us take the example of tuberculosis. So total number of deaths because of tuberculosis in a year, in 2000, divided by total deaths in that area, in that time, in that year. So now there is a difference has come. In crude death rate, in the specific death rate, we had mid-year population as the denominator. Here the denominator has become total number of deaths. And last, which I want to discuss, is case fatality rate. It is the most commonly asked question in NEET. Case fatality rate informs us regarding the virulence of the disease, or it is better, correct phrase is virulence of the agent. Rabies kills 100%. So rabies is a very virulent disease, while influenza kills less. So influenza is a less virulent disease. So how case fatality rate can be calculated? It can be calculated total number of deaths because of TB divided by total number of cases of TB into 100. Case fatality rate is normally calculated as percentage. Even proportional mortality rate is calculated as percentage. Whenever we use word proportion, it is always in percentage. So proportional mortality rate is not multiplied by 1000 but by 100. So let us do a numerical which will clarify your doubts. Write down this numerical. In a village there has a population of 10,000. So total population of village is 10,000. Total number of deaths in a year in that village is 1,000. We will take a whole number so that we can do it easily. The calculation is easy. The total number of deaths from all causes are 1,000. Total cases of malaria in that village are 500. So that year 500 cases of malaria occurred and 100 people died because of malaria. So we have 4 figures now with us. Total population 10,000. Total deaths from all causes 1,000. Total malaria cases 500. Total deaths because of malaria 100. So what will be the crude death rate? Now crude death rate in this example I will like you to calculate, and I will discuss in the next talk. I will reply again, we will come to reply, but I want you to do it. So remember the 4 figures: 10,000, total deaths 1,000, malaria cases 500, deaths because of malaria 100. And we have to calculate crude death rate, malaria specific mortality rate, we have to calculate proportional mortality rate due to malaria, and we have to calculate case fatality rate because of malaria. So 4 things you calculate. If you can calculate it correctly, you will be very confident of the 4 concepts. There are other mortality rates also, like adult mortality rate. Just remember one thing, that adult mortality rate, the numerator consists of deaths occurring between the age of 15 to 60. This can be asked in NEET. It has not yet been asked, but can be asked. Remember, adult mortality rate 15 to 60 years of death. Automatically the denominator will become total population between the age of 15 and 60. It will not be mid-year population, but only population at risk. We will close here, and next time I will go to morbidity indicators, and we will try to do disability indicators, and that will finish what we have started with 11 pages of Park, which we have done in 30 minutes. And we have covered both, we will cover both NEET as well as our university examination. Thank you.